record. So we'll be recording this webinar, and it's also being live streamed on the Facebook page, which I hope that is working. I had to do that twice also. Some of those little Zoom quirks. We were going to have Spanish interpretation, and I apologize again for that not being available. All attendees will be muted, and I will be unmuting the presenters when it's their time to speak. But if you have any comments or questions, please put them in the chat. There's a chat button at the bottom on the toolbar for Zoom that you can access so that you can put questions in there or even comments. We will be saving the chat for to look at later. If you're on Facebook, you can post a comment and we will share your question if we have time with the panel members. We're going to do a breakout room activity later in the presentation, and so you will be able to participate in a smaller breakout group where you will discuss a specific question that will be asked to you. People on Facebook would not be able to be part of this activity, and if you would like to, you would need to register on Zoom. I did put that link in Facebook so that you could register and come into Zoom. We will let you know how the breakout groups work real briefly. You'll automatically be put into a breakout room. It's going to be for 8 minutes. At 7 minutes, you'll see a little timer saying there's 60 seconds left, and you will automatically be put back into the main room. We are going to set up a Spanish only breakout room. So if you would like to belong to that Spanish speaking only breakout room, please let me know in the chat, and I will work my hardest to make sure that that we get that room set up for you. So that's the logistics. Next, again, conversation with the Equity, Diversity, and Inclusion Task Force, and we're going to be asking them to talk to us about education, communication, healing, and breaking barriers. The agenda, we're going to have some introductions. We're going to have an overview of Healthy Mendocino and the Community Health Needs Assessment, and then we'll have our introduction to the Equity, Diversity, and Inclusion Task Force. Our presenters for today are going to be Medi Parrott, who's a pediatric nurse practitioner at Ukiah Valley Rural Health Center. I believe that's the Adventist Health Ukiah Valley. Ulysses Velasco, who's the Vice President of Student Services at Mendocino College. JD Shepard, who's President of Leadership Solutions. Roseanne Ibarra, who is Director of Community Wellbeing at Adventist Health. And Erica Nunez Reyes, who's Mendocino LatinX Alliance Steering Committee member. She will be the one who will be doing our small group activity with breakout rooms. Then we're going to have a question and answer section and then closing remarks. So to start off with, Molly Rosenthal, who is the Healthy Mendocino Coast Coordinator, is going to give you a brief introduction about Healthy Mendocino.
Hi, everyone. Pleased to be with you this afternoon. So Healthy Mendocino was founded in 2013 and as a health data repository under fiscal sponsorship within NCO. As Patrice mentioned, we are now a program of NCO as of this fiscal year. Our program supports community health improvement activities and the work of organizations and grassroots groups throughout the county that are addressing community well-being, equity, and root causes of health disparities. So our activities fall into about 3 buckets of work. The CHNA, which is the Community Health Needs Assessment, and Patrice will go into that a little bit more in a few minutes. There's a multi-agency collaborative led by Healthy Mendocino that assesses the top 3 health priorities in the county, and it's done every 3 years. Our website, healthymendocino.org, is a resource and tool for organizations. It has health data, local stories on community health improvement work, health events, resources, best practices, and we really try to make this a bird's eye view of health projects underway in the county to help inspire strategic action and collaboration. Possibly the most visited feature on that website is our health data and health indicators and demographic data. Organizations use this for grant writing to help inform their next steps, and they're also able to compile custom dashboards and reports for their projects. So if your organization has any suggestions on the type of data that would be useful to you or your project, please get in contact with us. Again, the website's healthymendocino.org. And finally, the third bucket is we help foster collaboration, not only using the website, but by convening groups and community leaders to share ideas, network, and with the hopes of sparking collaboration. We also work to engage the community and to identify barriers to health and wellness in our various communities in the county, and to better understand how these can be addressed. We did a round of listening tours in 2019, and the report on that can be found on our website. Next slide, please, Patrice. So our mission, Healthy Mendocino works to improve quality of life in Mendocino County by encouraging informed dialogue about the actions local residents and organizations can take to improve community health. We value collaboration and partnership, catalyzing change by identifying gaps and sharing evidence-based best practices to help create innovative solutions. And we value building relationships by connecting people, ideas, and actions. On your screen, there is a collection of all of our funders and supporters that provide invaluable support and guidance for the project Healthy Mendocino. Next slide, please. Just some of the work we've done during COVID. This is a COVID-19 resource library that we compiled last spring as sort of a master list of support services, information, toolkits for everyone in the county who's been impacted by this disaster. And we have a Spanish language section, a section for professional resources, and also links to other organization and agencies' resource lists. I'll now turn it back to Patrice, who will go talk a little bit about the CHNA, the Community Health Needs Assessment, and introduce our panel.
All right, thank you, Molly. So as I wanted to let you know, the Community Health Needs Assessment, or a CHNA, is something that quite a few, mostly nonprofits, hospitals, counties, it's an assessment that they need to do for certain, IRS tax reasons. But a lot of agencies use it to mainly be able to identify what's going on in the county to assess the work that they're going to be doing themselves in their own strategic plans. So we started doing, Healthy Mendocino started being the lead of a collaborative CHNA back in 2015, and we completed a 2016 CHNA, and then the last one we did was a 2019 CHNA. The last one we did was something that, we have community partners that help us, mainly the clinics and hospital, all three hospitals now, the county, and we have a lot of other agencies that help with this process. And again, it's something that is used to assess and identify the most pressing health problems or priorities facing the residents of our county, and then to commit to a set of strategies that would help to improve the health and well-being of the residents. So the findings from the report, which is of course on the website, provides a great deal of information to inform how to prioritize the work that county agencies do for either their strategic plans or any kind of action plans that they may be putting together. And so even agencies that don't work directly with us will look at that CHNA to see what kind of information came up. The way we identify the three top priority areas is based on the analysis of primary and secondary data sources. One, the primary is a survey, the secondary data sources is data that is compiled from other organizations. We also do key informant interviews, which are actual in-person interviews with leaders throughout the county. And then that gives us what we see as the highest community health needs. So in 2019, we identified mental health. Mental health was also the top priority for 2016. Now we have domestic abuse and substance abuse. So these are things that we pay attention to, and here at Healthy Mendocino, we try to gear the work that we do with these three priority areas in mind. So we share the information between all sectors in the county to try to engender collaboration And we also can gather continuous community feedback that we can share out with other agencies to help inform their next steps to improve community health. If you are interested in being involved in the next CHNA, which hopefully will be starting next spring, you can always get a hold of Healthy Mendocino. You can get a hold of me, Healthy Mendocino, at ncoinc.org. And we can get you involved, which would be great. So now I am going to be switching this over. I'm going to have Roseanne is going to share her screen, but we're now going to be having the presenters talk to us about this new task force. And again, these are the presenters. I don't have, Medi's name is not on here, but she's one of our presenters. But if you have any questions or any feedback, please put them in the Zoom chat. We are going to do our best to keep track of what's happening on the chat so that we can ask those questions. So I'm going to stop sharing and I will allow Roseanne to share. 1 minute, Roseanne. Okay, so you should be able to share now. Oh, and you're muted. Yep. I will unmute all the participants now.
Thank you, Patrice and Molly. Good afternoon, everyone. My name is Roseanne Ibarra. I'm the Director of Community Wellbeing for Adventist Health. I'll be pulling up the PowerPoint here. It's really nice to see the participation we have here this afternoon. So 60 people I see we have logged in, and a really nice diverse group representing different agencies. Let me pull this up here. And so our first speaker is going to be Janie, as soon as I get this queued up. It's not coming up for me. Bear with me 1 minute here. Okay. Here we go.
Yay.
Is everyone able to see that? Let me make it out larger. All right, so today we're going to be talking about the task force here that we have in Mendocino County. Sorry about this. And Janie Shepard will be our first speaker. Janie?
And hello, everyone. It's really amazing, as you said, Roseanne, to see what a wonderful, diverse group we have, and so many people interested in this topic. So next slide, please.
Janie, and can you speak a little bit? It's hard to hear you.
Oh, okay. Let's try that. Next slide, please. Can you hear me? Great. Terrific. So to this morning and afternoon is to help to ensure that we have a kind of a common language, right? So that some of the terminology that we might be using throughout the next hour or so, that we're all on the same page about what we mean when we use some of these terms. So again, this is not an exhaustive list, but it is a list of something that will help us as we start to have conversations about equity and racial equity and racism and dismantling racism. Next slide, please. So the first one is prejudice. Basically, it's an attitude based on limited information. We use stereotypes with prejudice. It's not always negative. Positive and negative prejudices, especially when addressed or directed towards people who are oppressed, it's very damaging. And so people say, well, it's prejudice. In some cases, it's necessary for survival. Some cases we need to be able to take information and use it really efficiently. But in other cases, it's very damaging. And none of us is free from prejudice at all. Examples would be women are emotional, Asians are good at math, certain people don't tip, etc. Next slide, please. Oppression. Oppression is systematic. And so oppression is the systematic subjugation of one social group who has more power over another social group. And that power comes in several format. So social, economic, political, and it benefits that group that's in power. The target groups take in and internalize those negative messages that come from oppression, and it's kind of like almost end up cooperating with the people who are oppressors and start acting like them. And oppression, then people start to internalize that oppression, and we end up with internalized racism. If we go down to the bottom of this slide, we'll see that oppression is when we take power and prejudice and put them together. If I have the power and the prejudice and put them together, then I have oppression. Next slide, please. Social and institutional power. You will hear us throughout the afternoon talk about dismantling institutional racism. Well, we're dismantling and addressing social and institutional power. And social and institutional power is really related to access to resources. We've had some questions even come in already about access to resources for economic resources. So anyway, access to resources, the ability to influence others, the ability to participate in decisions, access to those decision makers in our community. That could be our city council, it could be our board of supervisors, it could also be access to decision makers that are in the workplace, such as supervisors, people who's sitting at the table. And the ability to define reality for yourself and others. Next slide, please. And when we talk about a system, we're talking about individuals and we talk about systems. When we talk about systems, we're talking about an interlocking set of parts that together make that whole. And it's an established way of doing something such that things get done regularly, and we assume that that's the normal way of doing it. But not necessarily so, because it depends on who put that system in place and the benefits of the people in power to the people in power who put that system in place. A system runs by itself. It doesn't require any planning or initiative by a person or a group. So when we talk about racist and racist systems, again, it's not about a person or a group. We're talking about an entire system that's been put into place to benefit one group over another. Next, please. Next slide, please. And then the idea of white supremacy. And so we have this vision sometimes when we talk about white supremacy that is the tiki torch carrying folks or the people wearing sheets. But really, which is true, that's all about it. And so are the Nazis. All of that is certainly about supremacy and white supremacy. But it is actually ever present in our own institutions, in our own cultural assumptions. Whenever we assign value or ideas of morality and goodness to one group, right, a racial group, and saying that one is better than the other. The interesting thing about that is that, as I'm sure some of you or most of you know, is that race is a social construct. It is not biological. There's no such thing as race. We made that up. And then we went ahead and assigned attributes to each race to say that one is better. So some of them is, people of African-American people or Black people run faster, or they're better at something, or because of a race, particular Asian people are smarter. Or for example, another one might be that Latinx people work harder. But all of those things, none of those things are assigned to race. And so if we look at race, really look at race, there are more differences between people who are like the same than there are between, for example, Roseanne and I would have more things in common than maybe another person of African-American descent and myself. Next, please. We have three separate expressions of racism. So the first is cultural, and cultural is when we say that they're the ways in which the dominant culture is founded, and then that dominant culture then goes ahead and defines and shapes the norms and beliefs for the rest of the people. And what we have in our current society is that those values, beliefs, and standards advantage white people and oppress people of color. And that's the way our systems have been set up. The ways in which the dominant culture defines the reality to advantage white people and oppress people of color shows up in our norms and our values and our standards that we assume are correct. And we accept that, and then that ends up in some of our cultural expressions of racism. Women on the welfare are assumed to be Black or brown and portrayed as irresponsible, things like that. Next slide, please.
Hi, Janie. Sorry to interrupt, but I just wanted to let you know you have about 3.5 minutes left.
Where'd she go? Huh, we lost her.
Oh, did we lose the connection?
Yeah, I don't see her anymore. We'll see if she comes on.
Okay, I can pick up from here. So three expressions of racism. So the concept of institutional racism, when we're thinking about the institutions in our nation, and then, you know, thinking from there also at the state level and local level, and how racism is embedded in our policies. And then personal racism that is inherent in something that's exhibited in an individual and having our own implicit biases. And now Mehdi Justina Parrott will be our next speaker.
Hi, everyone. Can you hear me? Yes. Okay, good. Thanks. So this is a great slide from the Surgeon General, and it shows how the amalgamation of these experiences among people of color, really you can't tease out what how much one influences the other. They're all kind of merged together in creating a more negative overall societal experience layered on historical experiences for people, especially of African American and Indigenous American descent. Next slide, please. Here's an explanation of a little bit of how this happens, right? That traumatic events don't just come and go, they get embodied, they become part of your person. And so we know that the burden of these traumatic events are heavier among Indigenous people, Latinx people, African American folks, because of their history of oppression in this country. And so those things don't go away, you know, from generation to generation. In fact, they are layered. And so they're sort of a multiplying effect. And so when one member of the community, even though when they're not affected directly, when another member of their community is affected, they feel that same trauma. It's almost a re-traumatization, similar to what folks with PTSD feel. And it's not really vicarious trauma. It's very, very personal. And so then the stress of all that going through every day, with that level of, you know, hypervigilance, which means you're always watching your back. You don't know when you're going to get attacked. You don't know when there's going to be a racist or prejudicial statement directed at you. Just being always on the alert kind of wears on your body, and that wear and tear adds up to ill health, right? Next slide, please. And so we've known for quite a while that you know, when people say, oh, the apple doesn't fall too far from the tree, statements like that, we know that kids inherit some of the characteristics of their parents. But, you know, we've always surmised, is it a genetic influence? Is it nature or nurture? Really, it's both, right? And now we're learning more about epigenetics, which are how even our genes are changed by our experiences, and those genes get passed on to future generations. So if you look at this slide on your left, in 1995, some researchers came up with adverse childhood experiences, which negatively affect your health as an adult. So they're usually a combination of like mental illness or substance use in the family, poverty, anybody being incarcerated, separation, etc. And then, of course, domestic abuse. And so it's the layering of that. And then because the child is never able to feel safe in their own home, in their own skin, with the people that are most familiar to them, then they get the impairments, right? So they don't do as well at school, they don't function that well socially, and then they start, as to cope, they start adopting health risk behaviors, and then they get sicker from that and they die earlier. And so that was what we knew in 1995. But now that we are a little bit more focused on the issues around race in this country, we're now starting to acknowledge that there's actually this generational embodiment, again, that feeling, that incorporating that trauma into your body, with historical trauma. And then there's also, not only are people of color historically oppressed, but there's also the current social conditions of racism that we experience. And so all that, it's a similar layering, where, then there's ACEs and complex trauma added on to that, because they tend to live in poorer neighborhoods, go to poorer schools, have poor healthcare, etc. And then allostatic load is really the wear and tear on the body. And then, again, it goes on the same layering pyramid that you see over here. And then throughout that lifespan, there's these microaggressions that Janie had mentioned earlier, implicit bias and the epigenetic influences from your whole family and from your culture. And go ahead, next slide, please. So here is the slide on the right, and I just wanted to go over how healthy Mendocino's priority areas actually fall on this ACEs pyramid. And so next slide. So you'll see where mental health, oh, is that right? Oh, okay. Oh, all of it's now in. Okay, sorry. So there's domestic abuse that goes into adverse childhood illnesses, along with parental mental illness, parental substance abuse that add up to the childhood experiences. But then as the child grows up, they also then have the disrupted neurodevelopment, social impairment, and etc. And then they become the parents that then perpetuate these to their kids and down the generations. So and then you see the underlying condition, the social conditions that we live in within racism and the historical trauma all added up. Really, the solution is not to address the early death, right? We shouldn't intervene in the ICUs. Maybe we shouldn't intervene with high blood pressure, diabetes, obesity, all the stuff that we're preoccupied with at the moment. Maybe we should be addressing how to prevent re-traumatizing people who already have this level of historical trauma. Maybe we should be addressing racism and ACEs early on. And that way, not only are efforts more effective, but it kind of just, there's this huge societal improvement from those efforts. Was that my last slide? Oh no, there's one more, I think, right? Yeah, so just to go over briefly what that Latinx mortality advantage is. So Latinx immigrants who as a group have lower socioeconomic status and have less access to healthcare, typically they have even better health and longer life expectancy than non-Latinx US whites who have more access to wealth and healthcare. That's why it's called a paradox, right? So COVID-19 has turned what were positive factors of being really in touch with family and community, and now has turned that around into infection control risk factors. So we need to address the disparities that our Latinx communities are suffering by sending messages, health messages that resonate with with that. The fact that they love their families, that they put their families first, that they're extremely hardworking, community-minded, and religious, and not at trying to criticize some of these things that make them who they are, that are normally protective. I
Thank
think
you,
that's
Mary.
it for me. Yeah, thanks.
Ulysses?
There you go. Can y'all hear me?
Yes.
Okay, good. Hi, welcome everyone. My name's Ulysses Velasco. I'm the Vice President of Student Services at Mendocino College. I'm also one of the co-founders of the Mendocino LatinX Alliance. And through my work there, I've been now a part of this task force, and we've met regularly over the last several months to address several things that we see happening throughout the county, mostly as concerned citizens, and then informing and providing feedback to the different county and organizations within the area. And right now I'm gonna just go over, I think it's either 3 or 4 slides really briefly, but give you an overview of where we are as a county, our current state, and how we fit into the conversation that's happening not only statewide, but nationwide. Next slide, Roseanne. And here's some examples locally that can help us connect to what's happening, like I said, at the national level. A lot of the unrest that we've seen throughout the country and a lot of the protests and the voices that we've heard can be seen at some instances that have occurred here locally. In 1998, I don't know if many of you are aware, but I was informed of this instance with Marvin Noble, who was shot and killed by a Ukiah police officer. And if you boil down to this situation to the bare essentials, it was a mental health situation that escalated very quickly and resulted in his death. So this was an individual that was receiving assistance locally, failed to comply with mental health orders, and police was involved, and it resulted with this person being killed. An ambulance was called, and this individual had injured a canine, police canine, and it appears that assistance was provided to the canine, and this person died as a result of being shot. So I'll leave that one there for a minute, and then mention an instance that happened just this year with Ukiah City Council candidate Jenny Kimbler and what she posted on social media. And I'm going to read portions of her lengthy post just to address again how this links, how this local event links to the national conversation. Jenny Kimbler's post was in regard to the Breonna Taylor situation. She explains that the cops served a no-knock warrant, that they said no one, that the police identified themselves, and we all know what happened as a result. Breonna was shot and killed. What Mrs. Kimbler says is that her boyfriend is to blame. And then the resulting protesters, she says, "It is sad and I feel for the family, but the fact is what the protesters are doing to these cities must be stopped at all costs. Move in the National Guard, and if they persist on spitting and throwing things at the police, I say light them up, shoot them, run them down. I don't give a damn anymore. I've always said, don't be a criminal or hang out with criminals, and your chances of living are a lot better." So that's just a portion of what was posted. And again, these events on their own are important for us to address, but once you start adding them up, that's really what we see in our communities that lead to situations that eventually lead to protests and unrest. As part of our group, we had moments where we expressed our thoughts and our feelings about these situations, and I mentioned that the Breonna Taylor situation was a little bit different for me in how I reacted to it. I had a very similar immediate reaction. If she had not been associated with her boyfriend, who apparently was associated with other things, then this wouldn't have happened. But then after reflection, really the issue is with, why do we have no-knock warrants that put people at danger? Why does it have to escalate so quickly that it leads to somebody losing their life? Why does a mental health situation lead to a potential death by not treating them with the appropriate response? So it's those kind of moments and those kind of self-reflective moments that lead to us better understanding the situation and lead to us being better engaged in what's happening. The opposite is when they don't get addressed, when nothing happens, when they just keep continuing, and these types of moments continue to happen in our different communities. And that leads to discontent and disengagement in the process. And we see that throughout all of our communities nationwide. There is a serious lack of representation in leadership positions for people of color. And that is either through elected positions and appointed positions. So it applies to both. Those that locally, before the most recent election, I believe there were 0 people of color in the Mendocino County Board of Supervisors. In local city councils, there were no people of color in Fort Bragg. Prior to the most recent election, there was only 1 Latino in Ukiah City Council, and similarly in Willett City Council. I believe that Ukiah now has 2, but really we see that nationwide. This is not something that happens locally. There is a disengagement that has happened for years and decades. And part of it is through the policies and the application of those policies that we see that impact that disengagement. So that has other effects as well. And I'll go through 2 slides really quickly to show how it impacts other areas. We all know how the health disparities amongst Latinos, not only locally, but nationwide. Latinos are affected at a higher rate than everyone else. One of the things that our group has worked on, and others in the community have as well, is in better communication in English and Spanish. So that's available to folks throughout our area. And I don't know if you've seen the dashboard from County Health, but that is now in Spanish as well. So that's something that we've advocated for, and the county has responded to that request. Other disparities that we see, not only locally, but nationwide, is the school to prison pipeline. They affect people of color at a disproportionate number, and homeless youth numbers that we see locally. Next slide.
About 2.5 minutes left, Ulysses.
Thank you. So the school to prison pipeline is greatly impacted by students in continuation schools. So we've all heard about how students of color are, what's the right word, are more negatively impacted than their white peers. And these are the statistics locally. In South Valley, 65% of students enrolled are students of color. Mendocino County, 87%. Noyo, 53%. Round Valley, 62%. So again, those numbers are disproportionate to people of color than the general student population. This again are students that are either required or have to be in continuation school as a result of policies that exist in our K-12 system. Next slide. And then quickly, homeless youth locally. This was a point in time count as of January 2020. A disproportionate number were American Indian youth. So again, these are things that get impacted by our policies locally and nationwide. And how we react to them and what we do greatly impact, as Janie was saying, our history, our ability to have better outcomes and remove and reduce the equity gaps that exist, not only locally, but nationwide. I don't know if Janie's back, but she's our next speaker. Okay, thank you so much.
Thank you, Ulysses. I'm not certain if Janie is with us either.
She is, I just have to find her. Oh, there she is. There you go.
First, I was thinking it was something I said, guys. Just, I went in there. I'm like, whoa. Anyway, as you always know, somebody's got your back. Thank you. So just taking a look at the landscape here in Mendocino County, one of the things that I don't know if you got this when I was sharing a little bit before, but about race being a social construct, it's just not real. We made it up and we assigned value to different races, positive or negative value that really just doesn't exist. But the other thing that we've done is we have taken people and said, well, you're a minority. So we're going to look at, this is just Mendocino County. We're going to look at Mendocino County, and we're going to say that in Mendocino County, we have 15% Latinx. We have 0.7% African American. We have 11% Native American. We have this. However, that doesn't help us to really see the reality of the landscape. It doesn't help us to see the reality of the power of the diversity that we have in our community. Because if we look at the reality, it's that almost 40% of people in our community are people of color. So instead of taking and putting people separately, right, African American and Native American and Asian American, and making them separate, we as people of color have very, very similar experiences because of that systematic and systemic racism that we talked about a little bit earlier, right? Things that have been put in place to benefit one group over the other. We can go all the way back to, I think it was 1934, FHA, Fair Housing Act, that led to all kinds of redlining, which changed the way that people had access to capital, had access to being able to purchase homes. And so, and then pass on wealth. And that didn't just happen for one group of color, it happened for all groups of color. It also happened for, in a different way, for people who were put on reservations for land that was their land, and then moved to that. People who came from, again, different parts of our world and told that we were minorities and things taken. We had even looking at our beautiful islands in Hawaii, where we had a queen and we had Europeans come in and literally put her in her own home castle, and she just took the islands because people liked them and they wanted them. So we want it, we take it. So looking at that, again, putting together those experiences of people of color are very, very similar. And so it's really helpful when we can see it as one and not separate people. There's power in that. Next slide, please. We talk a lot about equality, and equality is a good thing. However, this graphic we found to be really powerful. And the first is, let's look at the reality. So the reality is that some folks have a lot. They have way more than they need, right? And then others, it's okay, they have just about what they need, and some aren't even in the game. Some are actually not even able to get to the bottom of the fence, nonetheless, to see over it. So that's our reality. And if we look at equality is giving everyone the same thing. So what you need or not, we're going to decide what's needed, and then everybody gets that. Okay, but equity is different. And equity is giving people what they need, and removing barriers and giving what's needed so that everyone has equal access. And that's why we talk so much about equity and not equality. We want to get way past equality. That's over, right? That came with laws and all of that. We want to talk about equity, but even more so, we want to talk about justice and liberation, because if you look at that last slide, that's where we want to be. Let's take the fence down, right? So not just access to it, but let's take the daggone fence down and allow people to see what they can be and to have access to what they can be, to the resources they need to be what they can be. And again, we thought this was incredibly powerful because it shows not only where we are and where we've been, but it also shows the hope of where we can be. So when we talk about our mission of dismantling racism by 2023, and people say to us, that's not possible. And we're like, yeah, well, you know what, it is, and we're gonna do it. And we're not gonna do it alone. Of course, we need everyone else. We need the whole community to do this, but we have to do it because we can't live on the far left anymore. We can't live in that reality. And we need to be far right, which is liberation. And what you don't see right there is justice. We need to remove the fence. Next slide, please. Mehdi spoke brilliantly about ACEs, the adverse childhood experiences. And a lot of us have talked about that. We are continuing to talk about it. The field is still growing. We're still learning. ACEs was conducted by the Kaiser Foundation. And so most of the people who were, this is not to put down any of the information, it's amazing working on it, but most of the people who were in that study were white, male, and insured. And that doesn't mean that it doesn't get to be applied to other people, but again, just as we talk about, you know, the vaccine and how that's coming out and how we need to test it on different groups, et cetera, to see what's the effect and impact on people who are different. The same thing with ACEs. So next slide, please. If we look at this, we now talk about the para-ACEs. So Mehdi shared about the adverse childhood experiences. A para-ACEs, right? Looking at that para-ACEs, the second ACE is adverse community environments. So now we've got the trauma of adverse childhood experiences. We're going to layer that on top of, or layer one on top of the other, of adverse community environments. And those adverse community environments include poverty. They include a lack of opportunity, access to economic development, access to economic mobility, access to capital, social capital, financial capital, access to housing, but actually experiencing poor housing and violence. And Mehdi talked a lot about that, but also racism and discrimination. And so individuals, in addition to all of this other stuff, individuals who are living in adverse community environments are also people of color. Add to that racism. Add to that the going in for a job and being very, very qualified and, you know, not getting it. Or add to that walking into a store and having people follow you just because of the color of your skin. And we can just put a million things in there. But anyway, add all of those things. Add to that being an immigrant and coming into the US and being blamed for a virus or for spreading a virus. Add to that being in a line at a grocery store, which really happened in Willits, and having somebody in the line tell you that you are responsible for COVID and you should get into another line. And instead of being able to respond to that, because you have your child with you, you're trying to teach that child and protect that child, you don't even fight back because you just go. And that's not okay.
Janie, we have about 2 minutes left in your presentation, and we do have a question for the end.
Thank you, Molly. And so again, those things of being a parent, parenting in the middle of all this, right? So again, that pair of ACEs, when we start talking about ACEs, so please start thinking about that pair of adverse childhood experiences and adverse community environments. I believe this is the last slide, but next slide, just to be sure, please. Oh, it's not our strengths and opportunities. So, you know, this is all the things that we know, the things that are wrong. We know the things that don't work for the most part, and we know that we need to continue to teach and talk about the things that are wrong and that don't work. However, we also have some strengths, and the way that we can help to dismantle racism in Mendocino County and in this country is to be able to identify our strengths as well. Our group has done asset mapping because we want to talk about some of our strengths and how we can use them to address issues. Based on the time here, you can read that yourself. We're passionate communities members. We've done this before. We talk about it with even smoking. Who would imagine that there was a time when you actually smoked in a restaurant? But people believe that you couldn't do it someday. And so we don't do that anymore because it's bad for our health. It's bad for our community. It's bad for all of us. We don't do that anymore. That's what racism is. It's bad for us. It's bad for our community. It's bad for all of us. And so we can dismantle it and we must. And we use our strengths to do that. Go ahead next. I'm sorry, Molly. I think that's the last one. Can you next slide just to be sure?
Thank you. Rebecca Boyd had a question. Can you please restate the mission about blank racism by 2023?
Dismantling institutional racism by 2023.
Thank you.
When we want to do something, we put it together, we can do this, but we have to make it a priority and we have to believe that we can. Thanks. Roseanne?
Thank you, Janie. Hi, everyone. Roseanne Ibarra again. So my portion of the presentation today, I'll be talking specifically about the formation of the Diversity, Equity, and Inclusion Task Force for Mendocino, and then also talking about the work that we're doing and towards dismantling racism. So in terms of setting the context or sort of providing the frame of how we got here, here's a timeline on your screen. So the concept or idea for this task force was born back in February. And it stemmed from a conversation that Latino leaders came together. Supervisor Haschecht had reached out and wanted to do a Hispanic workshop. And so we were brainstorming on ideas and things that we wanted to convey to our leaders, and then also thinking about, okay, here's an opportunity and what is it that we would like to see in our community? And so there was the idea about the task force that came forward. And then fast forward into the pandemic, Ukiah Vecinos en Acción, who is a Latino group based in Ukiah and also serving our outlying communities, reached out to those 8 groups and regarding COVID and the lack of information that's in Spanish and the disproportionate impact on the Latinx community. And so we came together on a joint letter that was submitted in June. And then in July, there was a presentation, a formal presentation that was made. And that's when we put forward the idea for the formation of a task force. Then from August to September, there were individuals from those groups. And so those groups are Ukiah Vecinos en Acción, Mendocino Latinx Alliance, Fort Bragg Latino Coalition, South Coast Latino Coalition, Nuestra Alianza and Willits, Sueño Latino in Anderson Valley, Al Punto, and Mendo Latino. And it was in October when we had our first official meeting that was launched. And so during our time, what we've accomplished so far, we've been able to identify our common experiences. So I want to back up a little bit with the formation of the task force. So it was individuals, some representatives from those 8 groups, and then we also expanded and invited members from the Native American community, African American community, and our Asian American community, and allies. So it was about a group of about 15 individuals or so that have been meeting. And during that time, so we shared our common experiences of racism and identified goals to create, the purpose was to create a framework for the task force. We've completed 44 community interviews. The intention there was to get a sampling, so to expand just beyond our own voices, but to hear from other people of color in Mendocino County. What have been your experiences related to racism? And so this is our first act of reaching out into the community to get to hear from individuals. We will continue to do that as we proceed through this work. And we've also created our chart, the formal structure that goes along with groups, and then defined a communication strategy. Our vision is to dismantle institutional racism in Mendocino County by 2023. And we'll do this by lifting up the voices of the lived experiences at all intersections, honoring and mirroring the diversity of the community, fostering a safe work environment while establishing authentic conversations where honesty matters, and educate our community on intersecting identities and multicultural spectrum of abilities and strengths. Our mission is to educate leaders and shift institutional norms to prioritize equity in all things. And in terms of our work, so it's divided up into 4 categories: education, communication, healing, breaking barriers. So under education, we see our goal as educating the community and leaders on diversity, equity, and inclusion. We're currently developing a locally informed training about the lived experiences of people of color in Mendocino County. Under communication, planning is underway for a podcast called Project Reparations. Our first topic will be the traumas we carry, where we'll hear from community members. And really the intention here is to recognize that we've internalized trauma, and oftentimes we might not even recognize it ourselves. But the intent here is to really start the conversations. We see this as part of the healing work, to lift up those voices that have been in the shadows and to provide a platform where people can speak. Under breaking barriers, there's been a tremendous amount of work that the COVID work group has been involved in and has initiated. So there's been conversations with county leaders, and there's been progress that has been made. So currently there's simultaneous English and Spanish COVID updates. So there's simultaneous interpretation that happens. Our press releases, and you'll also see that the dashboard is both in English and Spanish. And there's now a strategy in place to do outreach to our vulnerable communities. So the county has engaged North Coast Opportunities to lead that effort. The Board of Supervisors also allocated funding and is contracting with Nuestra Alianza, the group in Willits, to launch a pilot for the Promotores de Salud. That's a community health worker model. It's a 6-month pilot, and they'll be working in Willits and Ukiah. So we're very excited about the progress that has been made, and we thank the County Board of Supervisors and Health and Human Services for the work that's been occurring. Also, under breaking barriers, we have reached out to our tribal nations. So here in Mendocino County, we have 10 federally recognized tribes. We would like to engage with those nations to support the communication and the government-to-government relation between our tribal nations and our county and city governments. Mapping equity is also something that's on our list that we would like to tackle, so that we can identify where are there points along, thinking about all of the systems that we have, right? And then thinking about Mendocino County, where are there opportunities where we can make investments that will enhance equity in our community. And then of course, there will be other issues as we proceed through this work that will arise. So for example, there's an issue that's on our radar regarding applications for housing assistance and support. We want to make sure that those are available in Spanish, and that there's also individuals at that agency to support monolingual Spanish speakers. Individuals that are interested in participating, we invite you and encourage you to join the COVID-19 work group. So that work group is meeting the second Thursday of the month from 5 to 6:30. So our next meeting will be January 14th at 5 o'clock. Also, with that local training that we're planning, we invite the public to let us know if you have thoughts about what should be included. Also, regarding the podcast, we're looking for individuals that have expertise in that area, and then also ideas. So please reach out to us. You'll see that our email address is on the screen. It's mendocinodei@gmail.com.
Thanks, Roseanne. I do have a comment and a question from our participants. They sort of complement each other. Liliana comments, there's a lot of resources for our community, but I believe one problem is our Latino community is not aware of the resource available for them. And Rebecca poses a question, can you explain more about what the pilot with the CHWs will do?
So I believe that question is specific to the Promotores de Salud pilot that Nuestra Alianza is launching. So that's a community health worker model. So there's individuals members of the Latino community that are fluent in Spanish that have been trained. There's 8 individuals. And Nuestra Alianza is leading that. 8 individuals that have been trained on information related to COVID and how individuals can be safe. There's a training that's going to be happening, and I don't remember the date, regarding worker rights. So what sort of safety precautions can an employee request? And so those 8 individuals are going to be deployed in the community to interface with community members. So the beauty about this program, and it's in other communities, is that you have members of the community that are the ones relaying health information. And so the intention is that this is targeted outreach to the Latino population, specifically regarding COVID.
And Paula asked if you happen to know why the pilot program is only in the inland part of the county.
I don't feel that I'm in a position to answer that question specifically, but Nuestra Alianza is based in Willits, and they're the group that stepped forward and said that they would be able to do a pilot project in Willits, and then also realizing that our high number of cases are in Ukiah, so they've also expanded to Ukiah. Any other questions?
Not at this time.
Thanks, Molly. Erica.
Hello, everybody. So when we first started our work with the task force, we interviewed people of color in Mendocino County and asked candidly how they felt about racism as it pertained to this county. And these were some of their responses. So if we could play the first video.
Roseanne, can you share, or did you want me to share my screen and share the video?
Is it not coming up?
Well, it'll come up for you. I just have it all queued up, but it's up to you.
Is it on the screen for everyone else?
No, you'll have to swing it over to your screen.
Okay, can you pull it up?
Yeah.
And
Okay, so you just need to stop sharing and I'll share my screen. Okay.
A Latina mother who has lived in the county for 31 years said, "Someone threw my food at me because I believe that they thought I had COVID, which I didn't. And I can't help but think it was because of my race." An African-American mother of 3 who's lived in the county for 23 years said, "The denial of racism has to be the most difficult experience that I have ever experienced." A Native American father who's lived in the county for 20 years said, "Getting stopped by law enforcement for no reason, asked if I was on probation rather than for license and registration. Institutional racism is sometimes subtle. People won't address what they can't see or don't believe is real."
I will stop sharing once I get to it. Okay, Roseanne, you can share again.
thanks, Patrice.
So I think a good question for everyone to ask themselves is, where do I personally stand on the issue of racism? Where has my privilege taken center stage? because racism isn't only lynchings and police brutality or verbally abusing somebody in the store for speaking a foreign language. The backbone of racism is really supported by the underlying issues or the quiet inequities, and the ones everyone knows about but refuses to directly address. And it's not just people in power making the quiet inequities laws, it's the day-to-day situations that support these laws. So when I hear someone say something like, I don't see color, I think to myself, how do you see all these quiet inequities happening around people of color, like unequal pay, unequal hiring practices, and unequal health disparities, among others, and say something like, I don't see color, as if nothing is happening here? And it's a figurative slap in the face to a person of color who is forced to see color every day, the second they walk out the door or they turn on the TV to see another Black man or woman unjustly shot, or a parent who is forced to have the talk with their teenager about why it isn't possible to go for a walk after dark or play with their toy guns outside. An ally is not just calling out racist actions happening around them or on TV, and it's not just hashtagging love is love or Black Lives Matter. It's not just giving a person of color the dialogue of an ally. It's your own day-to-day actions that make a difference in ending racism. So I have a video here for us to watch. It's a very powerful video by an author, Robin DiAngelo, and it's an interview where she discusses white fragility. So if we can play that video.
Erica?
Okay, so we were gonna go into a breakout room. Is there still time, or?
It looks like we have 10 minutes left. And I mean, as much as we'd love to do the breakout rooms, there are so many really good questions out there and discussions, that we could have. So I think we will not do the breakout rooms and go directly to two questions that were sent to us before the meeting, and then we'll answer any other questions that may be in the chat. So Molly, do you want to ask those two questions? Oh, and for the presenters, we're not sure who can answer these questions, but if you can raise your hand, I will look for you, and or maybe I'll just get you all unmuted and you guys can choose who's going to answer. Or raise your hand if you're still muted.
Okay, so Rich from United Way of Wine Country asks, how does an organization go about developing a board and other governing entities that are truly representative of the communities they serve, as well as the partners they work with to bring about lasting positive change? Specifically, he's worried about organizations tinkering around the edges rather than taking the bold steps to truly free ourselves from institutional systems that stifle real change.
I just want to jump in here. There were a couple more slides, but will I stop sharing? And we'll just go straight to questions. Janie, I think you had a response.
You're still muted, Janie. There you go.
I can't unmute. There it is. Okay. Sorry about that. I was, I heard some of it, but I was spending a lot of time saying I can't unmute. I heard some of the question. Could you please repeat?
Sure. How does an organization go about developing a board and other governing entities that are truly representative of the communities they serve, as well as the partners they work with to bring about lasting positive change, as opposed to tinkering around the edges rather than taking the bold steps for systemic change?
That's a great question. Thank you for that. I think there's kind of two questions in that. One is the kind of the logistics of how do you go about doing that? How do you go about getting folks in? And then the other piece is how do you make it real? I heard that tinkering around the edges, right? So the how do you do it is kind of in the same way we do, we look for other skills. First of all, we go to those communities. We fact that we get rid of the bias that people have deficiencies because of their race, and we think of them as having skills and abilities, and not get rid of that bias. So that's one. The other is then creating an environment so that once you get them in, they want to stay. If we do this whole checkbox, let's go ahead and get this person of color in because we want more people of color in. Don't do anything about the environment that you're bringing them into. That's not going to be super helpful. Either they'll leave or they won't be authentic. So one is go ahead and reach out into the community and the communities that you want. We look at what's happening right now in terms of putting together an administration at the national level for the president-elect. There's lots of people of color that are being invited and put into that. And people before said, well, I can't find anyone who's LatinX who can do this job, or I can't find an African-American person to do this job, or there's no Native Americans people didn't apply. Usually it's LatinX didn't apply. So one, we have to make it so that we're removing those barriers like we did in the equity infographic that we had up. The other is making sure that the environment that we are putting people into, that we put the effort and energy and passion into ongoing, making sure that that environment is welcoming for people of color. And then also asking the people of color what it is they need to be there. They have the answers, and it'll be different for each community, of course, but make sure that they have the answers. The other part then about making it lasting, again, I think a commitment to being okay with not being okay. Being okay with someone saying this is not working. Being okay with someone saying this needs to change, or we need to make improvements here, without taking it really personally. Just saying, okay, I get it, thank you, and let's work on that. So again, the outreach, the environment, and not checking a box. Does that help?
Yes, thank you. Any other members of the task force want to answer that? Okay, so Cindy asks, is there consideration for encouraging local government organizations or agencies to declare racism as a public health crisis? Several counties and cities in California have adopted resolutions in recent months.
Yes. Roseanne, do you want to speak of that? I mean, we don't have the power to do that, but absolutely, we know that racism is a public health crisis, and we look forward to that happening in Mendocino County. But Roseanne, I think you were going to say something.
I just wanted to say, the task force, we've had a number of conversations and thinking about what is it that we want to put in place. And so that's something that I think briefly came up, but we also need to put that on the list of things that we want to do. So thank you for bringing that forward.
Thank you. Okay, here's another question that came in through the email. Sam asks, it has become all too evident that there are many structural and cultural barriers to your worthy goals of equity, diversity, and inclusion for the Latinx community. I'm wondering how your members regard the potential benefits of better access to capital and new business development in achieving those goals.
We put some resources in the chat about access to capital and economic opportunities. Ulysses, can you unmute? No, I think, can we get Ulysses to unmute? I'm thinking that he's got some.
Try it now, Ulysses. Okay, try. There you go.
There we go.
Go ahead, Ulysses.
Molly, can you read the question again? I want to make sure that I fully address the question. Yeah.
I'm wondering how your members regard the potential benefits of better access to capital and new business development in achieving your goals.
I think at the core of the question and the the response is access, equal access and opportunity for folks, which doesn't always exist. One of the, the conversations that we've had is about like the simple process of applying for a job. It is very difficult, depending on the institution or the organization, on going through a process for applying for a position. One of the groups that I'm a part of, the Mendocino LatinX Alliance, our very first talk was about this misconception that there's a pipeline issue of Latinos not being prepared for, or not enough Latinos prepared for, those kind of higher level, high paying positions. And that's just not true. So part of the issue is access. Institutions and organizations and employers don't do enough to reach out and meet the candidates or the interested folks where they are. They expect folks to just come to them because it's easy. As an employer, as someone that hires people, it's easy to just say, I have a job, it's a great executive level position, you come to me. But if you haven't done the work to engage the community, if you haven't done the work to reach out to folks, if you haven't done the work to give them the tools that are required to go through the process, then you're going to exclude a large group of people. So we're talking about access and who you're excluding in that process. Additionally, we also have, we've reached a level of comfort that it's somebody else's responsibility to figure it out. It's not our responsibility. So if they really want it, they should do the work and come and get it. And we have to really change that mindset. And if we want diversity in our workforce, if we want, and I don't, if we need to have the conversation as to why diversity is good for an organization, then we need a completely separate webinar for that. So I'm functioning under the assumption that we all believe diversity is good. So we can reach diversity by being proactive and intentional about what we're trying to achieve. If we need to be representative of the communities that we're serving, then let's take a look around internally. Whose voice are we missing? And how do we include that voice? So if we need to hire specific people that represent a certain community that we currently do not represent, let's put all our resources in attracting somebody from that community to include at the table and help your institution, because that's really what it's all about. If you start there, then everything else trickles down from that. You're going to have people at higher level positions, at executive level positions, that not only benefit the institution, but it benefits them personally and their families. And then you can talk about the trickle down effect that can impact. So it really starts with you as an employer, if you have that capability, making a concerted effort to do an internal inventory of what's missing. What is it that you need to improve as an organization, and whose voice needs to be included in that? So again, it doesn't necessarily answer the question directly, because that's a complete different webinar, but I think you can start there.
Ulysses, can I build on a little bit of what you said? The other thing we could do in terms of the economics is people are working on restorative investments. And so it's restorative investing or impact investing. And so where foundations are actually looking at how do we give money, or how do we invest in communities using those social determinants of health. And if we do that, then when we talk about impact investing or restorative investments, removing barriers for economic advantage for communities of color. And so, for example, if I have living in an area that was formerly redlined, even though, like I said, in 1964 with the Civil Rights Act, you're not allowed to do that anymore. But still, if I have to look back and you're going to give me a loan and I live in that area, there's still comps or comparisons, and you have to do that. And so what I'm going to borrow in that area, I'm going to have to come up with way more capital that I don't have to start my business venture than someone who lives in an area that was not redlined. And so there's everything that Ulysses just talked about, from the individual access to income and earning opportunities, to the larger or bigger system, or if you want to kind of say like ripple effect out of how communities of color have access to capital, businesses, and are able to again buy homes and pass on wealth to their children and continue to do that in ways they've not been able to do that in the past.
We're at 1:32, so we didn't have time for the breakouts, which we apologize for, but this was an excellent presentation. And I want to thank all our presenters for being here and sharing your knowledge and your expertise. We are going to have a recording of this, and I will try to make sure that I can get copies of the slides. And also we'll have a copy of the chat. There's an awful lot of really great responses on the chat. And so we'll get that put on the website along with the recording and the PowerPoint slides so everyone can see them and share them. And if you have any additional questions, feel free to ask. We have those two emails at the very top of the chat. I have the Healthy Mendocino email and also the EDI email up there, and you can always directly email people and ask them your questions. We can keep track of them and put the answers on the website also. So this is an exciting time. There's a lot that's going on here in Mendocino County. So thank you for participating and being part of this discussion. And again, thank you for the presenters, and we will notify you somehow when we have everything up on the website and ready for you to see. So thank you and have a good afternoon.
Thank you.
Bye, everybody.
Patrice, did you stop the Facebook stream?
Thank you. I will do that. And I'm going to learn how to edit this time around. And I'll stop recording.